All right, it looks like our attendees are slowing down a little bit, so we'll go ahead and get started here. Welcome. We are thrilled to have you join us for today's webinar. Your interest and engagement mean a lot, and we hope that you find valuable insight into this presentation today. A few quick housekeeping items. If you have questions today, please drop them in the Q&A section. Also, throughout the webinar, we're going to ask for some interaction. So if you could put in information into the chat as we prompt you. And then also, anybody who would like to review this presentation later, we will be sending a recording out of this presentation. So you can revisit the content with your team and share it with your team. With that, let's go ahead and get started. In this edition of Help the Helper series, we're diving into the outcome tools and evaluation, and two essential resources for this, which are two essential resources for programs looking to measure and utilize their outcomes data effectively. Many of our customers appreciate the value of collecting standardized outcomes data through outcome tools, yet they often find themselves wondering what's next and how do they turn that raw data into meaningful insights. So today we want to address some of the common support challenges that customers have accessing their outcome tools. We'll explore how to structure your data for maximum usability with an evaluation report. And then we'll highlight real world examples of how treatment programs are leveraging their reports to enhance their services. So today, I will introduce our presenters. My name is Kristen Frankum, and I've worked as the former director of Outcome Tools for over 8 years, and trained programs and guided them in getting their outcome tools set up to automate questionnaire delivery. I currently work as the Chief Marketing Officer here at BestNotes. We also have Dr. Laura Mills, who specializes in helping treatment programs translate data into meaningful insights for clients, parents, and providers. With 16 years at Pine River Institute in Canada, she developed annual reports to demonstrate program outcomes. Since joining BestNotes a year ago, Dr. Mills has assisted multiple programs in developing evaluation framework to measure their outcomes effectively. And most recently, she produced an extensive evaluation report for the National Association of Therapeutic Schools and Programs. And then we have Chris Davis, who works as the admissions director at Legacy Treatment Center. She has been there for 10 years, and he has helped parents and clients find the right treatment for their find the right treatment by helping them understand what they will get when they come to Legacy Treatment Center. So with that, we'll just dive right into our presentation. So today we're going to cover outcome tools, some common support issues that happen with outcome tools, and then we'll turn the time over to Laura to discuss evaluation services, and then Chris will share Legacy Treatment and how they're using their evaluation report within their admissions process. So within outcome tools, we often get questions that happen over and over again. And so with this Help the Helper series, we really want to highlight some of the common questions that our customers are asking to help you with access and ease into gathering your outcomes data. So one of the number one support issues we get is the ability to actually even access outcome tools. The biggest part of that is because it is tied to a permission, and then you also have to create a user account. So first, within your BestNotes, you'll need to go check the user permission outcome tools under the clinical section. Only those who have the manage users permission in their BestNotes account will be able to do this. And so if you don't have manage users, you'll need to access that through your system administrator. The second item is once you have that permission in outcome tools, then you'll have to go into outcome tools and import. So there is a BestNotes import dropdown, and if they have the permission, their name will show up in that BestNotes import. They'll want to make sure to whoever's setting this up will want to make sure to add their email address and verify that and set a level of permission. And then the very last thing is to click the administration checkbox so that they will be able to access BestNotes from OutcomeTools. So the next thing is, if you have done those two things and you're still not able to access OutcomeTools, there are three things to check. First, make sure that you've created the OutcomeTools account. A lot of times people will say, well, I have the OutcomeTools permission, but I can't get into OutcomeTools. And it's almost always because they don't have an OutcomeTools account set up. And then sometimes as users are in BestNotes for a while, if your email address changes, you'll have to remember to go change that in OutcomeTools. Email addresses are the authenticator between BestNotes and OutcomeTools. And so if those don't match, then you will lose access to your OutcomeTools. And so making sure that you update your email address within your OutcomeTools account as well. And then the third, again, if that administration checkbox is not checked, you will get a "you are not an OutcomeTools user" error on your OutcomeTools tab in BestNotes. So make sure that you check these three items if you're still getting a "you're not an OutcomeTools user." Another common thing that we get is clients are not showing in OutcomeTools. So sometimes customers will call in and they will say, I have this client in BestNotes, but they're not showing up in OutcomeTools. When the very first time that you are having a client take a survey, you do have to click the Add Client button. So you'll see an Add Client button on the OutcomeTools tab. If that is still there, that means that client does not exist in OutcomeTools yet. And so the Add Client button needs to be clicked so that you can start adding surveys to that client. Another support issue is that our customers don't realize that you can only access OutcomeTools just from the OutcomeTools tab in BestNotes. You can hit Go to OutcomeTools, and that takes you to the OutcomeTools website. There's a little more functionality in the OutcomeTools website around reporting, adding series, editing your instances for your particular surveys. And so if you're only functioning on this OutcomeTools tab in your BestNotes, you do have the ability to go to OutcomeTools and you'll be able to see a little bit more functionality than you're seeing on the BestNotes side. And then viewing overall questionnaire results. This is maybe one of the things, if you've been using OutcomeTools for a while, you want to start seeing the compiled data of the information that you've been gathering for so long. We do provide an average scores report. This is shown on the Reports tab in your OutcomeTools account. And you can look at each individual survey and it will average out the number of all of the clients who've taken that survey within whatever range that you set on that average scores report. Also on individual client pages, there is a client dashboard where you can see progress over time. That is shown on that average scores report as a graph where it shows you over time how your clients are progressing. Another thing to note is that we do have a long list or a growing list of OutcomeTools that are available within your OutcomeTools account. So if you've been with us for a while and you haven't explored what surveys we have, on our BestNotes website, we have an OutcomeTools questionnaire library. This is just a screenshot, so you'll see some of our, they're in alphabetical order, so you'll see some at the top of our list here, not in order of importance. But there's also a plus sign on our website that you can open that up. You're able to see some validity reports, what populations those are served, how the survey should be delivered, and some of the psychometric properties that particular survey will measure. And so it's a really good tool if you're trying to decide what instrument you need to use within your organization. We can help kind of guide you, but if you want to do a little bit of your own research and finding what's available in BestNotes, you can go to that website and view our comprehensive list. With that OutcomeTools support section and kind of orientation to OutcomeTools, I'm going to turn the time over to Laura now to talk about evaluation services and what you can do with your data once you have gathered it. So I'll turn the time over to Laura.
Okay, thanks. Excited to be here. Hopefully there's some people I haven't met here yet. So today I'm going to talk a little bit about what, how to develop an evaluation framework and what to do once you get there. So just looking at some basics and the benefits of evaluation and some next steps. So throughout, I would love it if you could fill the chat with where your challenge is in starting or doing evaluation. Is it knowing what to measure, when to do measurements? Is it the cost or the expertise? So it would be great if we get your comments on what's your stopping point. It can be kind of this whole paralyzing experience to enter into the realm of evaluation because it feels like it's so many things and it's huge and it is a lot of things. So we'd like to help you with that. So, okay, Kristen, so before we start, I'm just going to give you a little analogy. So when I think about evaluation and where to start, you can think about it like putting on a long pair of socks. And fundamentally, if you have a long pair of socks and you just hold it from the open end, the top end, and pull it on your foot from there, things can get a little uncomfortable as you go down from the top. Like it might be twisted and your toes might not feel comfortable. And so the better way to put on a long pair of socks is to start at your toes. And you can think of it if you ever put nylons on too, like you don't start at the top. You start, okay, Kristen, you start where it matters. Like what I care about when I put on socks is, we can go to the next slide, is keeping my feet comfortable. And so we can think about this in the way like, this is what the important part of evaluation is. It's the clients, it's what matters. And if we always think about evaluation in terms of why we're all here, which is to help people, that's where we have to start. If we're doing it to prove to payers this or to check a box that's a state requirement that, sometimes we have to do those things, but evaluation should absolutely be about helping the client that's in front of you. So I'm going to talk a little bit about how you can get there. And there are sort of 5 questions that you can work through just in your own teams to understand like the direction your evaluation could go. And it's amazing when you ask maybe different teams in your program or your clients or their families or your executive director or your board of directors, who are your clients? Maybe people have different definitions and profile understanding of who your clients are. And then asking about what their daily experience is, this is one that puts it more in the client language. And so it's important that even though we might be talking at clinical language or evaluation language, if we always think about making sure evaluation, if it's about the client, we want to talk about our language in terms of their daily experience so that it speaks to them, it resonates with them. And the other 3 questions, what do we need to know to help the person right now? What do we do to help the people? And then what is their daily experience after therapy? So we're going to work through these 5 questions nice and easy, and we have some examples as we go. Okay, so who are your clients? And so I can speak to a lot of youth programs that I've worked with, and a typical client would be more than one mental health diagnosis in their past, probably have had a psychoed report done, have had history of treatment with various approaches, probably some substance use, very likely a dysfunctional family, disengaged with school or work, good chance of suicidality or non-suicidal self-injury. In general, really extreme emotions and unable to really navigate social or relational situations. And so that's sort of the clinical speak. The daily experience is that, this young person is trying to isolate. They experience emotions they just don't know what to do with. And so they turn to addictive behavior, whether that's devices or substances or eating or restricting. And for sure, they feel like it's a really trying experience to stand in the same room with the people that they care about. And so you can see there, you go from who are your clients and what is their daily experience. You can see the language change from something fairly clinical and sort of tangential to really being able to understand what a day is like. That's a hard day. That's a hard day for a young person. Yeah, we're good, Kristen. Okay, so if you're treating somebody like this or whoever you treat, the next question in that list of questions is, what do you need to know to better help that person who's willing to stand right in front of you and get help? And the temptation that I've faced with a lot of clinicians is they kind of want to know everything because they're treating a whole person. They're not treating one little slice of this person that is their depressive experience, and they're not just treating their incapacity to sleep through the night. And so the operative word here is need. What do you need to know to better help them? There's a lot of things that you can probably understand that that are going on with this person, but what do you really need to know? And is it their anxiety and depression? Is it their executive functioning, their ability to, get to their appointments on time? Do you need to know today about, how the family is functioning in the recent history? Do you need to know about sleep? Do you need to know their level of emotion extremes? I find this is a really common in young people in particular, is their incapacity to process and display emotions appropriately. And so it ends up being highly inappropriate, often toddlerish kind of expression of emotion. And so do you need to know where they land on that spectrum of, emotion regulation? Or do you need to know how they did in school last week? So what do you need to know to have a really good conversation and move forward with that client who's sitting right in front of you? And then you kind of do this funnel thing. You need to know all of those things. Well, some of them, they can just be questions you ask. You don't have to track everything. We are a very data-oriented society. We have data on our watches and our phones and our heads, on everything we see. What do you really need to know that you want to track? So in other words, like, what are you intentionally trying to change? What's worth telling the world that changes in your clients? So, so for example, if you think of a client, Betty Jo, and you treat this client for 6 months, and then a year from then you see Betty Jo on the street, what does she look like and what is she doing that makes you think our treatment worked? And that starts to get you closer to saying, this is how I tell my story. I see she's engaged with work. She actually is starting to go to the gym, and she's talking more openly to her mother, and she's smiling. She's making eye contact with me. We're not going to measure eye contact, but when you start thinking about a client, one client, and think, if I see them in a year from now, and I say, we really helped that person, what is it that you're seeing? And then you're really getting to understanding what outcomes you want to measure to tell the truth about what you do. And so in some cases you go from, say 10, what do I need to know to help this person right now, to what do I need to measure? And it might be just mental health, re-engagement with school or work, and the increased capacity to process emotions. And if that's what's going to tell your truth, then that's really all you need to measure. Okay, so in order to do that, basically you have to measure during your treatment process so that you can gather information from the person and share with them your interpretation of it, so that you can move forward mutually. And Chris was telling us a story the other day about a person, or about how Legacy uses their outcome evaluation as a part of their clinical meetings and uses it to help particular clients. And so, Chris, I was hoping you could tell us your experience with using your evaluation as a part of your client care.
Sure, yeah. So by using the outcome studies, it guides personalized care, right? We don't just guess. We are able to adjust treatment in real time based on the outcome data and tailoring that care to each client. So if something's not working, we know within days that that's not working because we're physically seeing the results, and also creates accountability. Measurable outcomes keeps our clients and our therapists aligned. The progress is very clear, the goals are shared, and the clients are engaged in the process, which is really important, we think. It also shows clients their results. When they see growth, they can stay motivated and invested in the whole process. It also has improved our clinical excellence, honestly. Our data drives improvement. The outcomes show what work, and we do more of it. So it's really been a helpful tool for our clinicians.
Yeah, I think it's great. So for me, if I were a client, there seems to be such a distinction between being in a clinical session and somebody saying, here's what I'm perceiving about your experience. And the other side is, here's what you're telling us in our survey. Let's look at this together, and we can mutually sort of talk about how we move forward. And as if I were a client, it would feel like they're listening to me. And doing that stupid survey I did a week ago or 5 minutes ago, I didn't want to do it, but now they're actually using it to help me. And so I feel like if evaluation is used right at the client level to help the person right in front of you, it can really be a great tool to supplement the clinical intuition. I don't ever think data should replace the knowledge and wisdom that clinicians use, but it is such a great supplement and a great way to get more buy-in from the client. Okay, Kristen. So I'm going to give you another legacy example, and this is client a female identifying young adult at Legacy's Juniper Canyon program. And how to read this graph is basically these are symptom scales, symptom scores. So higher numbers mean higher symptoms. And 0 is the cut point between healthy and unhealthy. So that red dotted line, you want symptoms to be below the red dotted line because then it's lower symptoms. So typically at Legacy, what we would see is people coming in at around 1 to 1.5 score above the clinical cutoff, and then they usually move into the healthy range. Being a 1 or a 2 or a 1.5, that is the number of clinically meaningful units different from the cut point. So basically this score of 3.25 or so is more than 3 meaningful units different from healthy. It's really, really acute. Like 1 is acute. So client A is highly acute. And then at the end of the program, client A changed her health score, her mental health score, from the 3.25 or so to about a 1.4. This is a lot of improvement. And so just like 1 is a magic number for the amount of meaningful clinical differences from the cut point, 1 is also a magic number for change. So a change of 1 is clinically and statistically meaningful change. So client A changed by like 2 whole clinically meaningful units. That's a lot of change. And then Legacy, they invest resources in connecting with clients 6 months and a year post-program. And amazingly, client A, who was so acute at admit, has sustained her end-of-program treatment gains. So this is a really great individual change story. But what I want to really show you about client A is what she looked like during the program. And so this pink line is client A during her treatment experience at Legacy. The pink is client A, and the green is a typical Legacy client. So as I said, typical Legacy clients come in at 1.25 or so. They do a lot of deep improvement over the first 5 weeks, then slow but steady improvement over the next 5 weeks or so, and then some sustained gains for the last couple weeks. And then 1 year post, we see those sustained treatment gains as well. So that's your typical, green is your typical trajectory of a legacy client. And then client A, who came in so severely acute at intake, first couple weeks, we see this amazing improvement. And then things went seemingly quite off the rails because she looked like she's headed right back to where she started in a non-linear way. And, you know, as we all know, the change is not linear. So we're not surprised about the non-linear fashion, but we are surprised that it's creeping back up. And so my question, I've never known this person. So my question to the legacy clinical team was, well, why was she still there? Why not get her to a higher level of care? Why not? And they said, we worked with her. We showed her these results every week. We talked about it. We felt like we gave her opportunities. And she said she felt safe where she was. She did not want to leave. And so as it happens, she was heading into the anniversary of her mother's suicide. And so her mental health trajectory was showing that her distress was going up and up. And once that this sort of came out in therapy and they had some work to do, they did a ceremony about it and did some work on the trauma, then her overall distress reduced to that one point and then was sustained through the last few weeks of the program and was still there a year post program. Like, I'm really amazed by the 1 year post for client A. I think it's amazing. So there's a couple things that come from doing, I mean, week by week, this is a lot of effort. This is a lot of effort and expensive amount of resources for Legacy to do. I think it's incredible work, and that they're using it with their clients to mutually track and plan for progress. So first of all, like, kudos to Legacy for doing this. And the other piece is that I think it's really, I always want to say, I appreciate you letting me show a client that doesn't look like the rosy success story that everybody wants to see. This is a client that, you know, some people would question, why keep this client here? And some people can question the safety of this, and even, you know, perhaps she needed to be in hospital, and who knows? But it's really brave of Legacy to let us use a non-typical example just to really exemplify the fact that when you measure progress throughout therapy, you can make course corrections and really try and understand what's going on, and it supplements what you see in front of you. Okay, so we've gone through who are your clients and what's their daily experience and what do you need to know to better help the client in front of you. And so now we're going to go into what do you do to affect change? And this is another thing that can be measured. So for example, at the program I used to work on, we always felt that emotional intelligence or maturity was the magic in our box that helped people change. And we measured the change on lots of things, from school to mental health to, you know, you name it. But it's really hard to measure maturity. And so when we found a way to look at emotional intelligence as a proxy for maturity, we did find that emotional intelligence changed over time, and it was a factor in really bolstering the improvements in mental health and behavior. We also found that when we measure parent emotional intelligence, and parents at Pine River Institute, they go through a parallel process of therapy while their child is in the program. And so we measured emotional intelligence of parents, and we saw that it was also a factor of change. So it changed a lot. And so as you're going through your evaluation plan or trying to plan for evaluation, you can look at what you do. And maybe it's DBT combined with some organizational training and family work. You can't really measure DBT, but you can measure trauma symptoms. And so, you know, you can say that because we do X, Y, and Z, you know, the client's mental health improves significantly. And you're really starting to tell your story when you understand what you do with whom to affect what change. And then for the daily experience after therapy, this I feel really resonates with parents and clients. And so when you can say, you know, 90% of our clients are back in school or back in the workforce a year after treatment, and they're communicating openly with family, and they're using tools to cope with their mental health symptoms, that's something where it comes back to the language that you want to speak to your clients. Okay, Kristen. So I'm going to give you another example, and this is about Eclipse at Elements. So Eclipse is a new program by Elements Wilderness Programs, and they're treating specifically neurodiverse youth. I think this is a great idea because I know from some research that I've done that neurodiverse youth are more challenged to have equal outcomes as neurotypical youths. And so I think this is an excellent idea to have a specific program. And so when they started, Neil came to me and he said, we're starting a brand new program and we want a fully blank slate. We want to measure it right. So what do we have to do? And so, okay, Kristen, so we had about, I'd say 6 consultations for me to get to understand those 5 questions. Who are they? What are you going to work on? You know, how will you know if it's changed, and what will the client look like after? And so, we had some very specific language and words that we wanted to make sure that we understood. We looked at about 10 or 11 elements that they felt they got it down to 10 or 11 things they work on, with executive functioning being the number 1 and family functioning being the number 2 focus of the therapy. And so once we had an understanding of what gets worked on, then I went to work trying to find tools that really mapped onto what clients work on. And we got to a list of 6 or 7 tools that are measured at different times. And sometimes it's the family measuring it, sometimes it's the youth, sometimes it's the clinician. And depending on what the survey is, it's done at different times. Like program satisfaction isn't measured until the end of the program, obviously. And then, you know, the how will clients change, that's again, just the language that you can speak to clients and families. And so this was, I felt like this was just such a great process because I think it helped Elements really define what they're doing with who. And then they got to a point where they can measure it and tell their story really clearly about what they're doing at their program. Okay, so then the real benefit of starting at the client level and making sure everything fits for the client is that the benefits just roll right up to the provider. So you can tell your story about how you help your clients. You can tell your truth. And you can go ahead, Kristen. At Legacy, you know, so they measure mental health, relationship, and social and behavioral distress. And again, it's that same thing where it's like 0 is the cut point, and 1 is a magic number. And you can see they make a lot of change on mental health, and they also make significant improvements and sustained gains on relationships and behavior. And looking at it this way, you can say, okay, well, we're doing great. We focus on mental health, so we're happy there. Do we need to make any changes on relationship distress? We change less, but they start less acute, and they're doing great. And it turns out, Derek told me that Legacy did make changes. They're doing more intentional and more intensive family work because they want to see more steeper, more profound improvements on their relationship health of their clients. So I think, to me, that's just great that they're using this evaluation to make program changes. And it's like, you know, to me, that's an evaluator's dream, is that they're really taking it to heart, being accountable, and making changes that are reflected in the data. I do know also that Derek was saying, you know, once they shared their evaluation report with their staff all really just got more engaged with the process of evaluation. They're more curious about it, and are more interested in what the findings are. Okay, so I was going to ask Chris again. So in terms of admissions, I thought this was really, Chris, why I was hoping to get some of your awesome insight in terms of how you've used your report as a part of admissions.
Yeah, so I've used this a lot because, it answers families' biggest questions. Do we do what we say we do, and does it work? I learned early on in admissions that there's usually two kinds of families or parents, if you will. One is a heart, fills with their feelings with their heart, and another one with their minds. And the ones that they want proof. The ones that use their minds, they want proof that this works. And so I have seen such a significant shift when I refer families to our outcome study. And like, if you want proof, here it is. Go read that. And it really has helped me in admissions to show that we are accountable for the work that we are doing. And it helps provide accountability for us as a program. And yeah, it's a fantastic tool to use in admissions. It helps those who need to see physical proof that the program is working.
Awesome, thanks. So it kind of goes without saying that the benefits of program evaluation are profound. It holds you accountable to clients and families and staff and payers and other stakeholders. And it's really just the right thing to do, to measure what you do and demonstrate your impact. And like all the right things, it's not free and it's not easy, and usually the right thing to do never is. And so there's one more benefit that happens, and that is to the greater field. And so kind of the top of the sock, if you will. Okay, Chris. And then, so basically, some organizations have already done a lot of work in this area where they've done multi-site studies, or in other words, they've collected data from several programs, put it all together, and they've been able to publish many, like dozens of scientific journal articles. And lots of conference presentations. And that should lead to helping more people or helping clients better. And so, if you think about the other side of evaluation, where what you learn from your program, you might learn something that could help other programs that treat people like yours. And they might be able to help their clients better by understanding and knowing more about what you do. And so there's a real opportunity to be a knowledge creator if you do good evaluation that starts at the client level. So really quickly, we're going to go to next steps. So what can you do with this? Well, you can work through the 5 questions, and it's not a singular activity. You should be talking to your whole team, your clients. Ask your client, if in a year I see you on the street and this program helped you, what do you look like? What are you feeling? What are you doing with your time? Ask their families, ask everybody, because you're going to get surprised that, your clients are going to say something different than the team. I have tried this, and sometimes I have really, really deep insights, and sometimes I have a group of teenagers that just say, we have our shit together. And that doesn't help me, but I mean, that's what they actually feel like. So it's good to know from all perspectives. And then you can sketch an evaluation plan on that. And really the biggest part of this, though, is an organization-wide culture shift. And there are going to be resource needs. And the reason why this has to be organization-wide is we used to think evaluation was somebody's side of the desk project, and it never works that way. We have tried it for decades for that to be the case. And it's just not going to work that way. First of all, leadership has to be 100% all on board, looking at the results, looking at the process, understanding what's needed, and it has to be backed by leadership. And that leadership has to make sure there's always somebody that is the champion of evaluation. It can be made a lot easier if you work with an organization that can sort of foster all the stuff where usually experts come in. And of course, we can help you with that. But you can work with any organization that is an evaluation specialist to help you go through the process of either starting, fixing, continuing evaluation. And then you're ready to implement. And Implement is one thing and sustained implementation is another thing. It is, again, a full culture shift with leadership engagement all the way along. I know that at Pine River Institute for 16 years, they refused to open doors without knowing we were going to demonstrate that we don't hurt kids. That was the fundamental point. We are going to measure what we do so we can tell people that our data shows that kids not only don't get hurt, but they get better. And so the implementation and sustained implementation is a culture shift that has to really be pervasive and long lasting. Okay, so that is kind of the gist of getting started and understanding how to develop an evaluation framework. And I was hoping to hear from the chats about where people are challenged, but I can't read the chat very well. Nicole, are you able to help me read it?
I have it, Laura, here. There's two questions in here. The very first one is what measurements, the question she has for her organization are what measurements to use and how to use measurements to make program improvements. And then how often and where to go to compile, evaluate data without too much cost.
Okay. And so what tools to use, it's a big one. It's kind of one of those paralyzing factors where people are like, I go on Google and there's 1,000 things that measure depression. And we can help you with that. There are some that are used internationally, tried and true, short, the words make sense. You can give it to any age. So there are some that are just real easy go-tos. But the important thing is that your clients can understand them and the language resonates with what you do. And so ideally, yes, we get a standardized, norm-validated tool that has been tested across populations, but it really has to be right for you. So that's the first thing. And you can look through the BestNotes tool library. I think that's a great start. There's all kinds of places where people find assessment tools, but the BestNotes tools library is actually a really good comprehensive list. I think there are hundreds of surveys on there, Kristen.
Yes.
So that's a great place to start. And really like print them off, read the questions out loud to yourself. Do they make sense to you? Would they make sense to your team? And when you look at the definitions of what they measure, is that what you want to measure? And so it's so people just want to know, I just want to measure depression, and it's so easy to say PHQ-9, like no problem, but it's not as easy. Nothing's as easy as we would like it to be. So I would say it takes some research and some time. There's the second part to that question.
How often and where do you go to compile and evaluate data without too much cost?
Okay, and so here's where, obviously we have OutcomeTools that stores, scores, and spits out data in a format that's pretty easy to use, but you still have to analyze it if you want to do a program evaluation. So you might need some help with that unless you have somebody on staff or know somebody who can do an evaluation for you. We do, obviously, that's my job. And so if not OutcomeTools and BestNotes, you probably have to do some research on a system that is going to connect to whatever you're using as your client record management system, and makes sense for you to, it's going to marry the two things. But fundamentally, you hopefully aren't keeping data on like Excel spreadsheets and just on computers and laptops and stuff like that. You really should be using a system that houses your data properly. And how to use that to make program improvements, you're going to have to get to the evaluation stage for sure. And so the easiest, so like I said, when Legacy used it they started doing more family work to try and really have more profound impact on the relationship side of the scale. You have to get to evaluation to understand areas to celebrate. First of all, you can understand you're doing great in maybe the family scores, but maybe you're not doing so good on the trauma symptoms. And so you have to get to a point where you have enough clients to do an evaluation and do an analysis to say, we can really say that now we're going to spend our resources on professional development in this area. And then again, you have to do an evaluation again to see if you have made improvements. I hope that answered that question.
There's a few others that I've answered in the chat, but I feel like it would be great to bring them up in this overall group. Somebody asked, what is the YOQ and is it in Outcome Tools?
The YOQ is the Youth Outcomes Questionnaire. It's 63 or so item questionnaire that measures 6 areas of health. So anxiety, depression is one area, behavior dysfunction, somatic problems like aches and pains without any reason, social problems, relationships, and critical items like intrusive thoughts, etc. So it's a YOQ. It's been standardized, normed, validated across multiple populations. So it's a good tool. And it's used really popularly among a lot of the US programs that are serving youth. So a lot of programs that are like NATSAT programs that are serving youth in out-of-home care. It hasn't been super well picked up outside of that arena. And so it's a nice summary evaluation if you want to get everything done with one tool. But I would say that if you feel like at some point you want to know your impact on depression scores versus outpatient, it might not be your tool. You might need to go to a more popularly used tool like the PHQ-9. That answered that question.
And then, someone also asked about can someone pull this data from Outcome Tools? Can I see data week by week for a client per assessment? And that was referring to the legacy client example.
Yeah, did you want to answer that, Kristen?
Yeah. So when Laura alluded to it in for legacy, they measure on a weekly basis and they actually deliver the OQ45 on every week to their clients. And so that's one reason why they can look at their clients week by week. So you would need to find a tool that works for you on a weekly basis if you're wanting to see weekly data that does show change over time with your clients. And then you can also look at that client progress chart and see the weekly changes. The chart that Laura was showing was from their evaluation report analysis, and so she was able to compile it from there. But we do have an average scores report that will show you. And then another question is, what kind of tool would you recommend to house the data that comes out of Outcome Tools? And maybe I can speak to this, and Laura, if you have anything to add. Again, asking the questions that Laura has presented in this presentation today, getting curious about your clients and what they need and what you want to see from a daily, weekly, monthly basis will help you decide what tool, which particular questionnaire is going to work the best for you. And then when you talk about what tool to house the data, Outcome Tools is where you're going to house that data. You're adding your clients in BestNotes, inputting their demographics in BestNotes, and then that pulls right over to Outcome Tools so that you can administer your instruments to your clients, whether that's in your office on an iPad or a computer or through email delivery. And then once you start gathering more data from your clients, then you can come into this analysis part and see trends that are happening with your clients and be able to make your program improvements based off of the data that you're gathering.
Yep.
Anything else you would add, Laura?
Yeah, I think I wouldn't add to anything to that. And I just want to clarify, you said that tool that you just sent is an example of how the data was compiled. Do you mean the legacy evaluation report? Can you just chat me yes if that's what the question is about?
Yes.
Okay, so yeah, so I worked with Legacy. They had their data in OutcomeTools, and we worked together. They said, take the data and tell us how we're doing, kind of thing. And they hadn't had an evaluation report done since they started collecting data like over 10 years ago. And so it was really exciting to get a hold of 10 years worth of week by week data and be able to provide them with that report. So if you have data, and a lot of programs don't even know how to access it or pull it or you know, analyze it, make it into a report. We can do all that at BestNotes for sure. But fundamentally, like my message always is whoever you use to help you do it, if you have data, you should try and tell your story.
Wonderful. Well, I don't think we have any other questions unless anybody else would like to. We did include a link to evaluation reports that Laura has done on our evaluation services webpage on our BestNotes webpage. You can see one from Legacy and one from Elements that she talked about. And then the most recent one was the NatSap evaluation report that was done for the National Association of Therapeutic Schools and Programs, which was a compilation of 51 programs who submitted data over a 10-year period. So if you're interested in looking at that, you can go ahead and click on those. They're flip books so that you can click on them. You can share them with anyone that is of interest within your organization. And feel free to give us a call, send us an email. We have Laura at bestnotes.com or Kristen at bestnotes.com. We would love to engage with you and answer any questions you have around this and help you be successful in telling your story with the data that you've already gathered. Do you see one more question came in? The cost of this. So this was really dependent on the amount of data, how many surveys you want to look at, and how in depth you want to go. So kind of base cost is $10,000 for standard evaluation report. We'd love to talk to you and kind of see what your needs are before we set a cost with you, though. But that gives you kind of a ballpark of what you're looking at. So if you want to talk to us further, please feel free to email us, and we'll set up a meeting and look at what you're wanting to evaluate and display over your program. So. Well, thank you all for attending. Thank you for your engagement and for all the work that you do. We really appreciate your engagement with this presentation and support. We hope you have a wonderful day, and we'll talk to you later. Thank you.